One of the things that needs to be remembered is that pain is not what we were taught. There's a lot of medicine that's not what we were taught, but especially pain is not what we were taught. And so we do all these things for pain, we ask all these questions, but most of them aren't relevant. Most of what we do isn't relevant. And the way we understand pain is not the way our body works. I remember hurting my own lower back on the Nautilus low back machine in like 1983 or 4. So out of my own personal experiences with pain, I was able to learn how to make mine go away. And as I learned how to make mine go away with the courses and bodywork things that I learned and did, I learned that I could make most anybody's pain go away by understanding pain a very different way. So the 5 rules are these. Rule number 1, you cannot believe the pain comes from where you feel it. Your headache does not come from your head, your blood vessels, or your nerves. Rule number 2, your brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing. They all come from the same place. They all come from the same kind of injuries, and the difference is not significant and doesn't matter. Rule number 3, at the end of the day, the only thing you can really believe is what you can touch and feel. And what counts most is where specifically, millimeter by millimeter, are you tender. Rule number 4, the places where you are overall most tender represent the kinks and injuries through your lifetime that generate most of the pain of which you are conscious. And rule number 5, better than 90% of the time, no matter how long you've had the pain, and no matter what you think is your diagnosis, 90% of the time, by dealing with the kinks and the injuries, you can make most of your pain go away most of the time. Because by the time you unkink your strings, and by the time you strengthen and heal your anchors, the pain will already be gone.